I see it. Joining me now is Republican Congressman Issa of California. Congressman, great to have you with us. You're the ranking Republican on the House Oversight and Government Reform Committee. Reese, do you agree with your Senate colleagues over there on the Senate side? You're in the House, but do you agree with what was just said?
Well, Ed, obviously you don't, so I'll move on to what I do believe. I do believe that this is an expensive way to accomplish something. Clearly, global competitiveness is how you get American jobs. We're spending an awful lot in this health care program to ensure but not get all people covered. We don't have the cost containment. I heard you ask for a single-payer system. That's your right. But until we start moving toward the 9% of GDP that Canada achieves instead of the 18-20% and growing that it cost us to create health care in this country, we're at a competitive disadvantage when we try to make things here and sell them overseas. That's what didn't happen in this bill that hopefully people like myself who came from the business world can be fighting for starting today.
Well, Congressman, one of the concessions that progressives in this country gave up is that the CBO, the Congressional Budget Office, never scored single payer. So we don't know exactly what the numbers would be because we kept asking the White House and asking the Congress, can you score a single payer? So we don't have a number as to whether it would be 20 or 18% of GDP or any of that. So I think until we get some hard numbers from those folks about that, I think it's hard to say that it flat out wouldn't work in America.
Well, I'm not debating single payer. That's a choice for the American people more broadly. What I am saying is sound science is when you look around the world at mostly single payer systems, what makes them cost 9% of GDP, less than half of what our system costs, is not necessarily the single payer. It's the limited liability. It's the health plans that clearly say we don't want defensive medicine, we don't want excessive procedures, and those countries have life expectancies as long as ours.
Congressman, is there anything in this bill you like?
Absolutely. I think it's a shame, it's a tragedy that state after state didn't come up with schemes to create portability, to allow for pre-existing conditions, not to keep you from going from one job to another, which was exactly what was happening in state after state. I authored H.R. 3438 to give every person in America access to the same health care that I enjoy, which, by the way, the federal workforce does have portability without regard to age or pre-existing condition. So it can be done leveraging private insurers, but more importantly, the states didn't do their job. That part of the federal bill, I think, was long overdue, and they would have gotten bipartisan support if that had been the bill.
We're short on time here, but I do want to ask you about the criticism that David Frum has come up with about the Republican Party. I'm sure you're aware of it. He says it could be your Waterloo. Your thoughts?
Well, I think that the Republican Party and individuals in leadership in the party, I hope I'm one of them, we have to have solutions for what we want America to do and how we want America to go. I tend to leverage my years in business and say, I know what it'll take to help America be competitive, to add jobs, not lose jobs. And I'm going to work for that. So there will be leadership from the Republicans. Without it, you're right. With it, I think the American people have a clear choice of directions.
Yeah.
I'd like to be part